Well, new at 10, when it comes to having a stroke, time is the biggest factor for treatment and recovery. CBS 4's Stephen Seeley joins us in the studio to talk about the advancements in stroke research.
That's right, Nicole. According to the CDC, strokes are the #1 cause for long-term disability and the #3 killer in Texas. Usually, there's a 6-hour window to treat stroke patients, but a recent study shows that with a combination of medication and imaging, the window for treatment doesn't have to be that small.
You may have heard the acronym for symptoms of a stroke, FAST, which stands for face drooping, arm weakness, speech difficulties, and time. But once a person experiences a stroke, time is of the essence, and now a new study is giving patients hope.
Which allows us to view anterior to posterior, as well as lateral projections of all the blood vessels going in and out of the brain.
Dr. Amir Hassan, head of the neuroscience department at Valley Baptist Medical Center in Harlingen, and the hospital's neuroscience program, participated in a study published by the New England Journal of Medicine in November of 2017. The research discovered that the window of treatment for stroke patients can actually surpass the proven 6-hour period, and that some patients can actually be treated up to 24 hours later. Traditionally, stroke patients would receive IVTPA, a medication to dissolve blood clots.
Now, for patients who come in anything after 4.5 hours, you can't get the IV drug, so this is your only treatment.
With that window of opportunity closed, stroke patients now have the option to be treated by using mechanical thrombectomy, a tool that Dr. Hassan has started using with his patients.
Which is a type of treatment for stroke where we go in with these little tiny tubes, go into your blood vessels, and pull the clot out. The idea was that majority of patients are excluded from these therapies because of time. So why don't we try to find a solution, and we did it through imaging.
The imaging allows doctors to figure out how much tissue is already dead, what's already stroked out, and what cells can be saved. Dr. Hassan says that many patients in South Texas seek treatment after the 6-hour window, which makes the research all the more important for this area.
Using this advanced imaging and afford him the current advanced technology to treat his stroke, they'll recover, they'll be fully functional, they'll be able to go back to work, go back to their families, and they won't be dependent.
Dr. Hassan says your diet plays a role in whether or not you're at risk of suffering a stroke. For more information about prevention and treatment, you can visit valleybaptist.net. In the studio with complete Valley coverage, Stephen Seeley, CBS 4 Valley Tonight.